Hello everyone, welcome back to Healthy Care. Did you know that prostate cancer is one of the leading health threats for men, with over 1.4 million new cases diagnosed globally each year? Even more concerning, it claims more than 3,750,000 lives annually, making it a silent danger that often progresses unnoticed. Sadly, many men overlook early warning signs, which could be the difference between early treatment and advanced complications. Today on Healthy Care, we'll unravel the subtle symptoms that must not be ignored. Explore the key risk factors and uncover the actionable steps to prevent this deadly disease. Don't miss this opportunity to learn how to protect yourself and your loved ones. Though small, about the size of a walnut, the prostate is a vital gland in the male reproductive system. Positioned just beneath the bladder and in front of the rectum, it produces the fluid that nourishes and protects sperm. However, when the prostate faces issues such as inflammation or the development of abnormal cells, the effects can ripple throughout the body. Prostate cancer begins when cells within this gland mutate and grow uncontrollably, forming a tumor. While many cases progress slowly, aggressive forms can invade surrounding tissues and spread to distant parts of the body like the bones or lungs, posing a serious threat to life. Understanding the role and vulnerabilities of the prostate is the first step toward recognizing and addressing potential problems. Did you know that 1 in 8 men will be diagnosed with prostate cancer during their lifetime? What's more alarming is that many of these cases are detected at advanced stages, due to a lack of early screening. The PSA, prostate-specific antigen blood test, and the digital rectal exam remain the gold standard for early detection, with studies showing they can increase survival rates to over 98% when the cancer is caught early. Unfortunately, stigma and misconceptions still prevent many men from seeking these essential evaluations. By prioritizing screenings, you not only increase the chances of effective treatment, but also reduce the need for more invasive therapies. Prostate cancer doesn't develop randomly. It's influenced by several controllable and uncontrollable factors. Age is a significant contributor, with men over 50 accounting for the majority of cases. Although younger individuals are not exempt, especially those with a family history. Having a father or brother with prostate cancer can double or even triple your risk. Race is another factor, with African American men facing the highest likelihood of aggressive forms of this disease. Lifestyle choices such as diets high in processed meats and animal fats, physical inactivity and obesity further amplify the risk. The good news? Healthy changes such as adopting a diet rich in fruits, vegetables, and whole grains while staying active can dramatically lower your chances of developing prostate cancer. Prostate cancer is often described as a silent adversary, but knowledge is your strongest ally. By understanding the risks, recognizing the symptoms, and committing to a healthier lifestyle, you can take proactive steps to safeguard your future. Stick with us here on Healthy Care as we dive deeper into the signs, risks, and preventive measures every man should know. Let's face this challenge together and build a stronger, healthier tomorrow. Symptom 1. Changes in urine stream. The first symptom many men notice when the prostate begins to enlarge or experience some imbalance is a change in urinary flow. There may be difficulty starting urination, a weaker urine stream, or even interruptions in the middle of bladder emptying. The sensation of not being able to completely empty the bladder can cause discomfort and anxiety. Although these signs are often associated with a benign condition called prostatic hyperplasia, they can also be indicators of prostate cancer, especially in its early stages. Therefore, if you notice changes in your urine stream pattern, stay vigilant and seek medical evaluation. The sooner the cause is identified, the better the chances for effective treatment. Symptom 2. Increased nighttime urination frequency. Another symptom that many men tend to ignore is the need to wake up several times during the night to urinate, a condition known as nocturia. This can be linked to various causes including infections, poorly controlled diabetes, and of course, prostate changes. When the gland enlarges, it exerts pressure on the bladder, triggering the frequent urge to urinate. Interrupted sleep due to bathroom trips affects quality of life, leading to excessive fatigue and irritability. While it may seem normal with advancing age, it should not be underestimated. If the situation worsens, or is accompanied by other symptoms such as pain or burning during urination, it is crucial to seek medical advice to rule out more serious problems. Symptom 3. Presence of blood in urine or semen. Hematuria, blood in the urine, or hemospermia, blood in the semen, are warning signs that should never be ignored. While they may have various origins, including urinary infections, kidney stones and other conditions, when linked to the prostate, they could indicate the presence of tumor lesions. This symptom, when caused by cancer, often appears in more advanced stages. Although each body responds differently, it is essential to remain calm if you notice blood in bodily fluids and seek clinical evaluation promptly. Imaging tests, laboratory analyses, and sometimes a biopsy will be critical to identifying the source of the bleeding. Even if the cause is not malignant, no apparent bleeding should be overlooked without investigation. Symptom 4. Pelvic pain, or discomfort. Many people associate pelvic pain with inflammation or muscular issues, but it's important to remember that the pelvic region houses various organs, including the prostate. A feeling of heaviness, discomfort, or even sharp pain in the lower abdomen, lower back, or genital area may be related to tumor growth. This discomfort can radiate to the back, making simple tasks such as walking or sitting for extended periods challenging. In advanced stages, the pain can become constant. Patients often confuse this symptom with muscular pain, which delays seeking help. Therefore, never underestimate persistent pain in the pelvic or lower back region, as it could signal something more serious. Symptom 5. Changes in ejaculation. Prostate cancer can directly affect the processes involved in producing seminal fluid and releasing sperm. Some men notice a reduction in semen volume or experience pain during ejaculation. These episodes might be mistaken for infections, but persistent symptoms deserve attention. In some cases, the tumor compresses nearby structures, altering the function of the ducts responsible for conducting semen. This can result in changes in texture, color, or fluid quantity. If this condition persists for weeks or worsens, it's time to seek professional evaluation. It's worth noting that many prostate cancer cases are diagnosed at this stage, even before the manifestation of more evident urinary symptoms. Symptom 6. Difficulty maintaining an erection. Erectile function relies on a complex set of factors, including the health of blood vessels, the nervous system, and, of course, the prostate. While erectile dysfunction can have many causes, such as diabetes, circulatory problems, and medication use, changes in the prostate gland can also play a role. Growing tumor cells can interfere with blood flow to the corpora cavernosa of the penis, impairing erections. When erectile dysfunction appears suddenly or progressively worsens, it warrants investigation. A simple checkup with a urologist can determine whether the cause is related to prostate cancer or another health issue. Seeking help early has the advantage of better managing complications and improving quality of life regardless of the problem's origin. Symptom 7. Feeling of bladder pressure. A common complaint among men with prostate issues is the constant sensation of a full bladder, even after urinating, and this occurs because prostate growth or inflammation can create a partial obstruction to complete urine release, causing residual pressure in the pelvic region. Frequently, men end up straining their abdominal muscles to urinate, which adds to the discomfort. This symptom should not be overlooked, as it can lead to complications such as recurrent urinary infections, since residual urine in the bladder encourages bacterial growth. In addition to disrupting daily life, this condition can worsen existing symptoms, such as nocturia. If the symptom persists, the best course of action is to consult a specialist and undergo imaging and laboratory tests. Symptom 8. Unexplained weight loss. In many oncological diseases, unintentional weight loss stands out as a warning sign. Prostate cancer, especially in advanced stages, can trigger metabolic changes and loss of appetite. Many individuals with prostate cancer can possess up to 20 times the usual body weight and act. Although this symptom is more commonly associated with aggressive tumors, it is essential to pay attention to any sudden changes in body weight. Loss of muscle mass and fat, without apparent reason, is often accompanied by constant fatigue, paleness, and weakness. If you notice your clothes fitting looser and your appetite diminishing without a clear cause, it's worth investigating the situation. Other health issues, such as hyperthyroidism and gastrointestinal disorders, can also lead to weight loss, underscoring the importance of comprehensive medical evaluations. Symptom 9. Fatigue and persistent tiredness. The sensation of relentless fatigue, even during routine activities, can have numerous causes. However, when a tumor is growing, the body often redirects significant energy to fight the problem, or struggles with metabolic changes that hinder nutrient absorption and tissue oxygenation. As a result, fatigue becomes an almost daily reality. Men who experience a noticeable decline in energy, without changes in habits or stressful routines, should consider the possibility of investigating their prostate health. This generalized weakness impacts productivity, mood, and quality of life, especially when combined with other symptoms. Even though fatigue is a nonspecific sign, it should not be ignored. The critical role of routine exams. Prostate cancer doesn't announce itself loudly. It often starts with subtle changes that only routine exams can uncover. Two pivotal tests stand out in the fight against this disease: the PSA, prostate-specific antigen test, and the digital rectal exam. The PSA test involves a simple blood draw to measure the levels of a protein produced by the prostate. While elevated PSA levels don't always mean cancer, they can act as a critical warning sign. Meanwhile, the digital rectal exam allows doctors to assess the prostate's texture, size, and shape, detecting abnormalities that might otherwise go unnoticed. Together, these tests significantly improve the accuracy of diagnosing prostate cancer. For even more precise detection, doctors may recommend advanced imaging, such as a transrectal ultrasound or MRI. Men over 50 or those over 45 with risk factors should prioritize these evaluations. After all, early detection can mean the difference between a simple treatment plan and a life-threatening diagnosis. What comes after diagnosis? If routine exams and biopsies confirm prostate cancer, the journey doesn't end, it's just the beginning of personalized care. Determining the tumor's stage and severity guides the choice of treatment, which could include surgery, radiation therapy, hormone therapy, or chemotherapy. Each approach is tailored to the cancer's aggressiveness, the patient's age, and overall health. For localized prostate cancer, confined to the gland, cure rates are incredibly high, often exceeding 90%. However, every case is unique. Open communication with your healthcare team and considering second opinions can empower you to make informed decisions and ease the uncertainty. Treatment options and their challenges. When it comes to treating prostate cancer, each option brings both promise and challenges. A radical prostatectomy, removing the prostate, offers a potential cure for localized cancer, but may lead to side effects like urinary incontinence or erectile dysfunction. Radiation therapy, whether external or internal, brachytherapy, targets tumor cells with precision, but can cause bladder irritation, rectal discomfort, or fatigue. Hormone therapy works by reducing testosterone levels, a hormone that fuels prostate cancer growth. While effective, it may lead to hot flashes, decreased bone density, or changes in libido. Chemotherapy, typically reserved for advanced stages, targets cancer cells that have spread, but often comes with significant physical tolls. Despite these challenges, treatments are highly effective when applied at the right time, emphasizing the importance of early diagnosis. Preserving quality of life during treatment. Fighting prostate cancer doesn't just mean treating the disease, it's about maintaining a fulfilling life. Physical recovery can be supported through pelvic physiotherapy to improve bladder control, and supervised exercise to build strength and stamina. Nutritional guidance, focusing on immune-boosting foods, helps the body remain resilient during treatment. Just as crucial is emotional well-being. Leaning on loved ones, joining support groups, or seeking professional counseling can reduce the psychological weight of the journey. Facing this battle alone can amplify fear and anxiety, so don't hesitate to reach out for help. Nutrition, a powerful ally in prevention. A healthy diet isn't just about staying fit, it's a frontline defense against prostate cancer. Studies show that eating plenty of fruits, vegetables, legumes, and whole grains provides the body with antioxidants and nutrients that combat harmful free radicals. Conversely, diets heavy in fatty red meats, processed foods, and sugars fuel inflammation, creating fertile ground for cancer cells to grow. The Mediterranean diet, rich in olive oil, fish, and vegetables, has been shown to protect men's health. Moderate consumption of soy products has also gained attention for its potential hormonal benefits. Every bite counts when it comes to prevention. Prevention beyond diet. Good health habits extend far beyond the dinner table. Regular exercise reduces chronic inflammation, strengthens the immune system, and regulates insulin levels, all of which help ward off cancer. On the flip side, a sedentary lifestyle can disrupt hormone production and encourage tumor development. Whether it's walking, swimming, or cycling, find an activity you enjoy and stick with it. Caring for your mental health is just as vital. Chronic stress can worsen inflammation and increase cancer risk. Prioritizing relaxation and finding balance in your routine can make a world of difference. Breaking the stigma. Open conversations save lives. For many men, the fear of discussing prostate health prevents early diagnosis. The digital rectal exam, while uncomfortable for some, is a quick and essential procedure that can detect life-threatening changes. Movements like Movember aim to destigmatize men's health by encouraging open dialogue and proactive action. By sharing knowledge and experiences with friends, family, or community members, we can help break down cultural barriers and save lives. Remember, the earlier prostate cancer is detected, the better the outcomes, and there's no shame in prioritizing your health. Prostate cancer is a battle that requires knowledge, vigilance, and action. End quote. Whether you're undergoing treatment, in recovery, or simply looking to protect your health, regular checkups, blood tests, and imaging scans play a critical role in detecting changes early. While these follow-ups may bring anxiety, they are essential steps toward ensuring timely and effective interventions. The promising news is that with early detection, prostate cancer cure rates now exceed 90%. And breakthroughs in medical technology and treatment protocols continue to provide even more hope for patients worldwide. Tip: at Healthy Care, we believe that health is the foundation of a fulfilling life. By staying informed and proactive, you can take control of your health and protect your future. If you've noticed unusual symptoms or have risk factors like a family history of prostate cancer, don't wait. Consult a doctor and take the necessary steps toward prevention or treatment. Remember, the earlier you act, the better your chances of a successful outcome. If you found this video helpful, take a moment to like, share, and subscribe to Healthy Care for more in-depth insights on men's health and overall well-being. Don't forget to hit the notification bell so you never miss our latest updates. Together, we can spread awareness, break taboos, and empower people to prioritize their health.